Morning to all, respected chairperson and all dear seniors and my dear colleagues. I'll be presenting on the challenges and remedies in minimal access pediatric surgery for beginners. We have to realize the biggest challenge is that pediatric laparoscopic surgery is not a one-man show. It is rather a teamwork. The role of a surgeon as a surgeon in pediatric laparoscopic surgery is not so important. Rather, the role as a team leader and who works as a collaborator with the surgical team is far more significant. In the initial stages, we might not get the team which we want. Rather, we have to work around with the team which we get. In that scenario, clarifying the roles of everyone in the team and by effective communication strategies, we can maintain good teamwork. In the initial stages, there will be a hurdle at every stages, which in some of my initial cases I have found that you reach the OT and you find the instruments are not sterilized because that is the last thing on our mind before a surgery. So the fundamentals of instruments, the importance of understanding the sterilization protocols and techniques is very important in this regard. Someday you reach the OT, you start the surgery, and then you realize that you ask for some particular instrument and that is not available on the instrument trolley, and you are waiting for the instrument to come. This is a very common scenario. For this, you have to realize that you have to familiarize yourself with all the instruments, energy devices, and stapling devices, and think beforehand that which all instruments I might require and check that before you start the surgery itself. Then someday it might happen midway during the surgery, you can't continue the surgery because your back is aching so much, your neck is paining, your hand is paining, because you are not taking care of the proper ergonomics. The port position is such that it causes pain, you are struggling, and it can lead to potential injuries and decrease the efficacy of the surgery. This laparoscopic tower is something which every pediatric laparoscopic surgeon should know like the back of their hand, and most of the troubleshooting you should be able to do on your own and not be dependent on someone else. The golden rule is if it is not working, just try to turn it off and on again. The setting up of the stage is of paramount importance because the patient position is of utmost importance for not only for the patient's safety to avoid any nerve compression injuries, any pressure ulcers, but also for the exposure so that your ports are not struggling against each other, you are not struggling with your assistant for space, and the stability of the patient, proper bandaging so that there is no unintended movement of the patient when you should turn the table around is also of importance. Then the access to the abdominal cavity, it should be not a challenge, it should be just a part of the initial preparation, just like draping the patient. The use of Varies needle in this regard I found very useful because you don't require any assistance. By the time the sister is doing the white balance, you can just enter the abdomen and start with the surgery. There have been multiple papers which have been show that Varies needle is equally safe and efficacious even in neonates. The port placement is of utmost importance based on the disease, the target organ, the size and the age of the abdomen to avoid complications. A solid understanding of the core surgical techniques of suturing, knot tying and tissue manipulation is important, and the only role of practice is there on endotrainers, and in small cases like appendicectomies and hernias, it is useful to avoid endoloops and do intracorporeal suturing. And we have to realize that we don't practice until we get it right, we have to practice until we can't get it wrong. And sometimes a difficult problem might have an easy answer, we just have to look around. And these conferences for continuous learning along with online learning platforms are very useful in this regard. Thank you.
So what sort of, what kind of online resources do you use? Or, do you go ahead, suppose you have, say, a pyeloplasty to do in the morning, do you watch videos of the procedure beforehand? Do you think it is useful? And what platforms do you use where you find educative material rather than promotional material?
Personally, I find watching videos beforehand very, very useful because sometimes it happens that a particular surgery, because of the wide variety of surgeries that we do, it is years, a couple of years before you, when you last saw that surgery done, let alone do it. In that scenario, like I had to do a achalasia surgery, and it was almost 3 years when I last saw the achalasia surgery being done. So reading about it is another matter, but watching it live helps a lot. And along with the basic YouTube, I use MedTube is a very good platform for that. And there is a ped surgery live workshops, live videos by Darius Patkowski sir and all, which I found useful.
Do you use websites?
Yes, yes, yes.
Thank you. Any questions, comments from the audience? I think, yeah.
Sir.
The question is, do you think a mentor is required? Do you need to, yeah, go ahead, Basant.
Do you think a mentor is required on simulator? Either do on turtle or some kind of videoscopic something?
Certainly, sir. Certainly, sir. Because during my training days, when my mentor used to do pyloplasty, someday he will let me do the dissection. Someday he will give me the pelvis to suture. So,
It's not about surgery. It's about before going to actual patient, you have to work on some simulator.
yes, sir. Yes, sir.
If you are doing on simulator, mentor is definitely required. How
Yes,
you stand, how
Yes,
you
sir.
hold
Yes.
the
Yes, sir.
camera,
Yes.
how make your body
Yes.
posture,
Yes,
when
yes.
your hand become tight,
Yes.
elbow, everything. So I think surgery is important. That is okay.
Yes.
But before going to surgery, if your mentor is giving on patient, it means you are quite capable on doing simulations.
Yes, certainly. Sir.
Thank you.
Thank you, sir. Thank you.
Thank you.